first, I would like to ask you both permission to use this video for educational purpose on the internet.
I give my permission.
Thank you very
Use it.
much.
Oh, yes.
Thank you. Now, tell me, how were you before the surgery? How were your symptoms?
Walking was very difficult. I would lose my balance to some degree.
Mm-hmm.
I had to do everything slowly and everything hurt.
For how long?
It started in July of 2017 and it continued until I had surgery in May of 2019.
So about 2 years. 1 to 10, how bad was the pain before the surgery?
Usually 9 to 10.
9 to 10, for
And I
that
was
long.
very irritated if somebody
Yeah.
thought my pain was less than I thought it was.
No, it was bad, and we noticed that your back was in really bad shape. And we did actually less than a month ago at the multi-level fusion OLLIF minimal invasive procedure. How long did you stay in the hospital?
2 nights.
2 nights, and then you went home, and then you told me that your pain got better. Tell me about it.
It's.
Initially,
I
pain-
lost the pain I used to have. The
Okay.
pain I used to have was like going down. It started at my waist and going down into my legs, and that went away. I had to get used to having a different pain in my lower back,
surgical pain.
surgical pain.
Yeah.
Yep.
But you said you felt better than many years before.
I had a day less than about 3 weeks out after surgery where I knew I was very positive. I knew I was able to I was at a meeting and I was able to contribute to the conversation. And when I drove myself home, I was sitting taller in my car
Okay.
than I had for
Okay.
2 years. 'Cause
So
I-
you felt much better, but
much
something
better,
happened. Tell me.
much better. And the next morning I woke up and I was irritated and crabby and my pain was back. And the snapping tension in my left leg was huge.
Yeah, but so after the surgery you felt much better, and then all of a sudden you felt not as bad as before the surgery, but still something got worse.
Yes.
And this is what this conversation is about. Now I'd like to ask you, what was your observation? You said that few days after the surgery, tell me about what was your observation there.
Well, she felt better immediately, or, okay, surgery on a Friday, she was feeling good on a Tuesday following. And she forgot about things like bending, twisting, and lifting. And she would reach down to things on the floor.
Yes.
And the next day, Wednesday, she was feeling the results of that and
Yes,
realizing, and we talked about, we got to watch this bending, lifting, and twisting.
Yeah, and this is an observation we make very often. Contrary to open surgery where people feel miserable for months, our patient feels so good, so fast that sometimes, they just forget about even they had a surgery and they want to live their usual life. But I guess those limitations bring them back to level of activity that's suitable for them. And most of the time, bending, twisting, lifting is going to be difficult because they put tremendous amount of pressure on our spine.
And one of the things noticed immediately, I believe, was that prior to surgery, she could not walk or stand, and that became easier right away, and that led to the overindulgence of activity, I suppose.
And I think the point I'm hearing is that the result of the surgery was so fast that any healthy mind wants to go back, live a normal life. And sometimes a normal life, especially when we get older, our bone gets weaker. A normal life is sometimes too fast.
I was 73 when I started with this, and I was 75 when I had the surgery, and I wanted to be like I was when I was 73 and hadn't had all this happen.
Yeah, but we are going to catch back 5% of the time, 98% of the time. People have this up and downs, and they don't really change much in the outcome, except that people notice that they have to give the bone time to heal. And that doesn't happen in 1 week or 1 month, but overall, I think you're still telling me that you're much better than you were before the surgery, and you practically, we are on the way of the healing to progressing to a point that you can do all of those things, but not just a week after the surgery. We just have to take a little time for that. And some physical therapy can show people how to go about daily activity, not to put too much stress on the spine. And that is exactly what we are going to do. Overall, we are happy with the results so far. We just have to slow down a little.
Yes.
Gardening has to wait, and bending, twisting has to wait a little. Or we have to modify the activities that you can live a full life without putting too much stress. But overall, so far, happy with the result of the surgery?
We're very happy.
Excellent, excellent. Thank you so much for the interview.